Welcome, everyone. Very pleased to see you here. We're going to have a warm debate, I would say, considering the temperature and considering the issue, which is climate change, health, and clean air. And in fact, I think I mentioned this before lunch. We do have, when we did the WHO survey about what are the gaps and opportunities, climate change in urban health, climate change came up as number one. So our people across the world thought that perhaps more that could be done. And so I'll introduce some of those issues just to kick off the debate and to ensure that we are in the, can you get the slides, please? Putting the right question. So we want to make it conversational and sort of, I'll speak first, I'll make some pointers around where we'd like to go. What I see are some of the gaps, but where I'd like to go in terms, or we would like to go in terms of organization, in terms of association, in terms of a global movement, and to have the speakers comment, introduce their perspective and insights. And then we hope, can you close the door there? So the idea is that I think we would like to really be much more stronger in our response to climate change. I mean, obviously, most people, except for the climate skeptics, and perhaps for some religious or sort of cults, are in agreement that there's an urgency for tackling climate change and to build resilience. We're also in agreement about the key drivers of climate change in terms of energy, housing, transportation, waste, food. And there's also, I think, the scientific has produced a lot of evidence about effective solutions and health benefits. So I think we're well placed in terms of that kind of knowledge. We also have, in terms of the urban community, I think we know very well that cities are a key part of that solution for climate. 2/3 of the carbon emissions, 2/3 of the energy use, 2/3 of people in cities by 2050. So it's not that we can avoid cities if we want to address climate change, or on the contrary, I think we should be going there much more. And in particular, the growth in populations in cities worldwide, in terms of the number of 1 million plus cities, etc., is going to be mostly and largely in Africa and in the subcontinent. So I would argue to the distinguished panel of ladies that we know what we have to do. I think we have gone there. I think we have a very good sense of what the kinds of policies and solutions that are in place that could be used. When the questions is how to generate change, is the how, and how to achieve scale. And we know that in order to do that, we have to be working across systems, across sectors, and engage different actors. So the call is for all cities, not only the big and shiny ones, all cities, big and small, rich and poor, including slums, and in many fronts, that they would, how is it that they can enact policies to mitigate, adapt, and to yield health benefits. So yes, we want better climate. And for that, we need less carbon. But having a tunnel vision that only focuses on the carbon, considering that people who have to move the agendas are individuals who have a number of other priorities, we're focused on the end of the world, if you want, for humans, but we're equally focused or more focused in the end of the month, and the issues that affect us in our communities directly on a day-to-day basis. So I think that illustrates as a graphic from a Dutch group that illustrates pretty well that there's a number of issues which are very high in our priorities as individuals, and carbon is one of them. So one of the questions to you is, how is it that we make those connections? And I'll just draw one image, which is the pyramid of health policy or policy change and what's required. This was done by Jill Walt and others in the a long time ago, and it's been evolving ever since. And there's as many, but you do have to know what are the contents of the policy that you want to develop, which are the content there, and what are the objectives, what are the aims, what are the assumptions, what are the values which are included in those policy options, and what are distributional impacts? Who is it that those policies are going to affect? And that's valid for transportation, for energy, for housing, for food. So that's important, not only that we know what the policies are, but what are those implications? Equally, we have to relate to context, social, political, cultural. So what is this place like? And why is it that policies needed, policy changes needed in this moment in time? The process is then quite important. Do we have, what do you put? You put the evidence for impact, you set an agenda, you compare options with cost-benefit analysis, with other methodologies. How much do you include of accountability, evaluation, etc.? So one important question is how the policy is brought forward. And central to all of this are the actors. They can be state actors, markets, civil society, organizations, etc., and their awareness, their capacity, their interest, their engagement, interactions and agreements. So I think the importance of this conversation focuses on the how, and where we would like to go as society. I think we're looking for your wisdom on that, is in order to get closer to the solutions to climate change, in order for us as a society who's global, who's engaged at many local levels worldwide. How is it that we could be doing more? And how is it that your work as international organizations can help us, inform us, and support perhaps, or interact or engage in this development? I think few groups worldwide will have this view of cross-sectoral connectedness, the systemic view of what the problems are and what the solutions are. So the group sees this as a systemic issues. And we're inviting you then, you inspiring comments and experience. So we have 4 people who work at the global level, who have a lot of experience in moving the agendas, the research agenda, the civil society, World Health Organization, World Bank. So I think is that conversation. So we'll start with having some points from you. So what do you feel are, and then we open up for a debate, both between ourselves and with the audience. I think we all very familiar. Many people know each other for a long time. This is going to be a frank debate. I mean, we're thinking about the future, and we would like your inputs. So the first speaker is Madeleine Thompson. Yes, and Madeleine is the boss supreme of climate change at the Wellcome Trust. She will tell us for those who are not from the health sector, who the Wellcome Trust is, but is a very important fund who's been doing major work in health overall, but also in climate. And specifically, Wellcome has funded the One Planet, One Health set of projects, which are being presented here, which have been part of our conference in previous years, which had a lot of urban content in it. So Madeleine is a scientist. She has been working with climate and health for many years in the university and elsewhere. And Madeleine, up to you to tell us a bit about also your new strategy on climate and health, which the Wellcome is about to release or already have released. Thank you for being with us.
Hello? Yes.
Yeah.
Sorry. So it's absolutely thrilling to be with you here. I'm really excited to join this meeting. Can I just ask a quick show of hands? Who of you are familiar with the Wellcome Trust? Yay!
Oh, well.
It's very exciting. I didn't expect that. But for the ones of you that are not that familiar, and also just to update those of you who've been following us a bit, or maybe have even received grant funding from us, I just thought I'd take you through a few slides about the trust, which was founded back in 1936 and is one of the largest private foundations in the world, actually, and certainly the second largest health and medical foundation. So we went through, when I first arrived in the trust was back in 2019 as the senior lead in climate change in the Our Planet, Our Health program, which had been running already for a number of years. What happened though in 2020 is the organization went through a complete re-envisaging of the purpose of the organization. Until then, Wellcome had very much followed a model of funding very high-end science, quite visionary sometimes, globally, in the UK, often very much through UK universities. And it had developed a wide range of programs and initiatives, including the Our Planet, Our Health initiative. But there wasn't really a consolidated strategic vision for the whole organization to come around. And so they had a major science review. They asked the global community what were the most important questions for research now in today's time, and gathered that information together and presented it to the board. And from the 10 that were presented, these 3 were chosen as the major challenge areas. So in the future, not only to fund discovery science, which is our core business, if you like, but also to fund science that is going to be much more applied, much more engaged with the needs of the moment. And the first of all was to fund infectious disease, because that's a really core area of expertise within Wellcome. Second, to fund mental health, because actually there's been very little mental health research funding for a very long time, and Wellcome is now going to be one of the largest funders of mental health research. And then to fund climate and health specifically as a new topic area, which is actually an extraordinary move for what is largely seen as a biomedical research funder. So you can see from this slide that it also describes that diversity and inclusion and research culture were also central to this new strategy. So it's a big re-envisioning of the organization, which actually resulted in a massive change in the organization, a restructuring. Many people left, many new people joined, and we've just started to settle down. So now, and it's been quite depressing really, because we haven't really been able to have that many conversations with the research community about what we're planning to do, because we really didn't know. Hopefully we can start saying a few things. And the first is that in the climate and health, we have a vision statement, a world where catastrophic climate breakdown is averted in a way that allows human health to flourish. So we want to bring those two things together, prevent the risks of climate change and at the same time advance human health. And our mission statement is very much putting health at the heart of climate change action. And within this, we have 4 goals. We are fundamentally a science funder, a research funder. And so our first 3 goals are very much around the research, looking at climate impacts, looking at the potential the evidence needed for mitigation, effective mitigation that benefits health, the evidence needed for effective adaptation that benefits health, and across all of it, the building of a new field or strengthening of the global field in climate and health. And as Carlos mentioned, in the program where I first joined, Our Planet, Our Health, we had already invested about 75 million over 5 years in a number of initiatives in this general area, more as a broader planetary health funding opportunity. And as part of that, 6 major partnerships were funded. We spent about £40 million on these 6 initiatives. 5 years, they actually have stretched into 6 years now. 4 of them were basically integral to the urban environment and understanding the urban environment and how to improve health and improve the spaces that we live in. So there is a presentation on Wednesday, which Kat will capture and share some of the learnings from these programs. But what we learned from that program, which we're bringing into our new strategy, which I think is absolutely essential, is the value of transdisciplinary science. Not only engaging with the policymakers from the get-go, but also with the stakeholders that should benefit from the research so that they are integral to the research process. So there's a lot of learnings now coming through from the early work in Our Planet, Our Health, which form the bedrock of our new work going forward. So really the questions that we're addressing now are, how can health evidence tip the feasibility scales towards limiting climate? So that's really, where does health matter? I mean, if we're going to decarbonize anyhow, maybe we don't need health arguments. But if health arguments can help not only improve our health at the same time as driving forward decarbonisation agenda, that's incredibly important. And how can we best protect vulnerable populations from the effect of climate change, which we now know we will inevitably experience, and really trying to understand that. So what we've done so far, and these are what we call our early investments, i.e. they were kind of our pre-strategy, where we just wanted to get resources out into the community to start developing in this area. We initially funded work on, I can't actually read that from here, so I just have to remember.
Climate sensitive infectious diseases.
Oh, yes. We did a funding on modelling infectious disease, a funding round on evaluation of heat adaptation, another one on biological vulnerability to heat, and then now one on mitigation actions. But these have been fairly short, sharp, just to get resources into the community while we're developing our theory of change effectively. So what is next? What is next is really in the kitchen at the moment, being cooked. But what we're interested in, and I think it responds to what you just mentioned there, is how do we bring and fund not only the research, but the research advocacy communication interface, so that we don't have researchers who then complete amazing studies, but don't have the capacity, the resources, the channels, etc., to really communicate their findings to the people who really need them. And then also, how can policymakers draw on the research community to answer specifically the questions that they care about? So I think I'll leave you with that for the moment, and thank you.
It's brilliant. Can I just... When you made a question around the research translation part, you talk about communication and about how governments can use it. You know, have you, I mean, because that's a research translation is and translation to policy is interesting to many people here, to yourself as well. Have you made progress on that and sort of formulating, articulating, or?
So what? One of the things with the new structure of the organization, previously we all kind of worked in silos, really in silos. You had money, you could go and spend it on these projects, etc. Now the whole organization is matrixed. So as the research team on climate and health, we have direct access to a translation team that shares their knowledge and experience on how translation works, etc. Policy team, government relations, communications, media, digital for science and health team. They are all cross-cutting now across these 4 areas: discovery, climate change and health, mental health and infection. So we don't necessarily have the expertise in our team, except our personal expertise where we've seen things happen. But the idea is to bring the whole of the organization, the weight of the whole organization behind what we're doing now. So hopefully we will be a lot more effective at doing things going forward. But I must say, I'm here for the next 3 days and I'm here to learn. So if you want to talk to me and tell me how we should be doing it, I'm very open to that.
Sounds wonderful. Thank you, Madeleine. Very good points, and very good to learn of your direction of travel, even if you haven't completely gotten there yet. The next points are going to be brought by my dear friend Maria Neira, who used to be my boss. And Maria has been a leader in climate and health and clean air and health over many years, and has been a very effective communicator and global actor on this, as well as leading the work in the WHO on climate and air quality and health. So Maria, I think having been in that experience, both in working in government, working as a medic, as a WHO official, and as a activist is not the word, but it was somebody who's really being active in promoting this. Having a reflection about what does that mean to work in cities all over the world? I mean, WHO is global, but the world is a big place. You have regional offices, you have country offices, etc. What comes to your spirit at this point in time of how to make those connections more effective, and how is it that WHO can provide support through its teams or through other ways?
Thank you, Carlos, and thanks as well for reminding everyone that we are very good friends for a long time. And probably if I am very committed to air pollution, it's because of you. So remember that. Whatever I do now, if I do well, it's your fault or your benefit. So thank you for that, Carlos. Let me maybe elaborating on what Madeleine was saying and on translating. This meeting, apart from the fact that this meeting reminds all of us the effects of climate change, look at the dress code. I mean, we are end of October, guys. I don't know whether you realize that normally in Spain, end of October is a very strong autumn, and we shouldn't be on these 26 degrees we have now. But in 2 weeks from now, we will be in Sharm el-Sheikh at the COP27. And WHO, by the way, supported very nicely by Wellcome Trust, we will be there on a very strong way, and we will have a health pavilion. Why I'm telling you the health pavilion, I hope you saw it, Madeleine, is spectacular. We are putting in the health pavilion 2 lands, Carlos. This is the representation now, because we want to put the health argument at the center of the COP27 to remind everyone that climate change is about CO2, but not only. So I like it very much, your narrow view of the decarbonization. That's one aspect. But in fact, what we are in WHO taking the opportunity of the climate change as well is to remind everybody that, first of all, we overlap very much climate change and air pollution, because as you well know, 75% of the causes of the global warming are as well the causes of air pollution, the combustion of fossil fuels. So for us, this is an obvious, strong health argument that we need to put at front. But other important messages we are taking to the climate change community are the famous co-benefits that I think now we can clearly call it benefits, full stop. Enormous human health benefits. And those benefits will come from 3 transformations. One is the transformation to clean sources of energy, the renewables. We need to stop burning things, burning fossil fuels. We need to accelerate this transit to renewable, cleaner sources of energy. The second will come from a more sustainable food system from the beginning to the end. And the third transition, but not third in category, is probably one of the first, is the healthy urban planning. There is no way to tackle the causes of climate change and air pollution if you don't address it at the urban environment. Because as you rightly say, 75% of the greenhouse gases emissions are generated by our cities. And almost 70% of our population in 20 years will be living in cities. So it's absolutely out of question that if we want to have an impact on climate change, we need to enforce policies, create mechanisms, motivate mayors, municipalities, academics, research institutions, citizens, anyone to go into the same direction. The same direction is decarbonizing, certainly, but as well creating the cities where we can have a better commuting, the famous sustainable transport system that we all need, and the solutions for energy efficiency and other that now are more critical than ever. So I think this climate change approach is the one that now more and more mayors and responsible for urban plans are realizing that they need to get into that. You're right, maybe they were not enough. And because they were not enough on that, they were missing as well some financial mechanism, because the Green Climate Fund, that I'm sure that you are familiar with, is one of the most difficult mechanisms for accessing funds, by the way. So if you didn't try, think twice before starting, because it's really complicated. But there are mechanisms that are created for responding to the challenge caused by climate change. And maybe the urban health community needs to start to get more into that and benefit for it. As you know, when we did, do you know the NDCs? How many people here knows the NDCs? Okay, everybody knows NCDs, of course, the non-communicable diseases, but careful, because the NDCs are the way you can tackle many of the problems we want to tackle at the urban environment. NDCs means national determined contributions. And the fact that the audience is not aware of that, it gives us a signal already that we need to get more familiar with the climate change community. NCDs is how every country at national level, they need to determine what are their contributions to achieve the famous Paris Treaty. And we need to start to wake up as a health community, and particularly urban health, to have a look at how much our famous mitigation strategy and health co-benefits are included there. Because otherwise the health sector will be completely marginalized, and all the plans that will be done at national level will not be considered. So this is one of the maybe mechanisms for getting together. Regarding the opportunities, Carlos, I don't know. I mean, there are so many mechanisms at city level that I think my answer to your question is taking all of them. I mean, the mantra here is don't lose a good opportunity. And the good opportunity can come from many aspects. Allow me 1 minute to present here the case of Ella Kisidebra. I'm sure you are familiar with this little girl, 9 years old, who passed away 10 years ago in London, officially because she suffered a very serious form of asthma. But in fact, 10 years later, thanks to the effort of her mother, Rosamund Kisidebra, the legislation in UK is about to change. And for the first time in history, on the death certificate of this girl, it says cause of death, air pollution. So, and because of Ella, then Ella is a citizen. The mother of Ella, Rosamund, started this campaign. This generated the interest of many academicians who started to report and document the case. So many universities got involved, many health professionals got involved. Then we have mayors. The mayor of London reacted and realized that this was generating some interest on the society, so he reacted. Then international organizations. Now that we are using this case at international level. So I'm using this little example because sometimes it's an activist, the one who creates the interest. Other times it's a mayor because he has some vision and willingness. Other times is because there is a financial support by an international organization. Sometimes it's because there are citizens that get together. Sometimes architects, they are becoming such an active force and passionate. The architects are now not only building houses, they are very much committed to this climate refuge at the cities level, and that they are engaging on the healthy design. So we need to make sure that we don't miss any opportunity, but climate change and air pollution certainly is one. The last three motivations for a municipal authority or mayor or whatever we want to call it, particularly on cities on low and middle income country. What will motivate? One will be the health argument, the case of Ella or of others, when you can contribute to the health of the people. That's very rewarding for a mayor, particularly if it's well known by everyone. Second, it can be a financial injection into a very interesting project that will generate results. And the third one is a political one, votes. If you are a mayor, you want to be elected in the next election. So more we document the health benefits of what we are proposing, the better for the mayors or the authorities, because they can use it with their citizens. I'm talking about tools. We have the health and climate change city profiles on climate change, so very much available to all of you, and other tools that we will be presenting in the plenary few minutes after this one. But I can sure we can talk more about that later on the discussion. Thank you, Carlos.
Brilliant. Thank you, Maria. I'll put one question. We are convinced that working across sectors is very important, right? But we also know how difficult it is once you start working in your own specialty as a medic, or, we all have our own tracks of work to do. So I think I'll just put in the conversation, what are the mechanisms? How is that we can do better in terms of creating mechanisms and what those mechanisms would be? You don't have to respond now, but I think if you want to.
Well, as I say, definitely administrations. Whatever you call it, an administration, it can be a mayor, or it can be a municipal authority, or it can be a group created under that city with citizens, with activists. Sometimes it's as I say, an international organization created. But I think the more you start by the end, saying those are the benefits, those are the outcomes you can obtain, more you can then accelerate the mechanism. I saw very recently the colegios de médicos, the professional associations of doctors and health professionals, very much engaged on this. I saw the urban planners, architects very, very much engaged now. The transport associations, they want to be part of the dialogue as well. So I think the mechanisms are there to be created, but we cannot rely on one. We need to, depending on the city, we need to accommodate and make sure that we don't miss any opportunity, I think.
Super.
Thank you.
The mechanisms, plural, and we're going to get back there. Thank you, Maria. And the next speaker is Joanna McLean Masic. Joanna comes from the World Bank. She's the global lead for sustainable city infrastructure and lead urban specialist for cities and climate change. The bank has just produced a new strategy for cities. So I'd like Joanna to tell us a bit about it, but also to reflect. The bank works in a lot of countries, in a lot of cities. What are the mechanisms, and what, in your experience, you've seen that would allow us to be constructing these mechanisms that we're talking about? How is it that we create something that can allow this broader understanding, these connections? Joanna.
Thank you. Hi, everyone. Can you hear me? Yes? Yes, that's good. I think I have my presentation here. So thank you for inviting me here. It's a pleasure to follow very illustrious speakers. So I'm here to represent the World Bank, and I think not missing opportunities, I hope that I can share a little bit about what we do. We work in 130 countries around the world, so I'm sure there are many touch points with the types of research and work that you're doing. And I hope you will get in touch with me if you have ideas after my presentation. So I wanted to share first a little bit about the World Bank, an upcoming report that Carlos mentioned, and then also some examples of the way that we work, and then finally some gaps that I see and opportunities. So at the World Bank, we have an urban portfolio of about 35 billion. We work at any one time around the world on about 200 projects in over 3,000 cities. I sit in a department that covers urban disaster risk management and land. So we think of ourselves more in terms of overall sustainable cities and regions. I wanted to just touch on the point that was made about the NDC. As of next July, all of our lending operations must align with the Paris Agreement. So everything that goes to our board as of next July will have to be climate ready, basically. And one way that we're doing that is we are now preparing country and climate development reports for every country that we work in. We started with the first batch last year of 30 countries. The first 6 have now been published, but they set out not just the NDC, but often the NDCs are not ambitious enough to meet the 1.5 degrees. So our reports look at what does the country need to do to be more ambitious. So I hope that you can have a look out for those. We will be having a Healthy Cities report coming out next year, in the first half of next year, and some colleagues here have worked with us on this, but the idea is to set out an action framework for urban policymakers in 3 areas. The first being around targeted interventions. So how do we identify the most vulnerable that need the health intervention? Integrated actions, as Carlos had mentioned, how do we work across sectors, but also levels of governance, national and local government? And then how do we be prepared? How do we prepare our urban systems to face the kind of health crisis that we've seen recently? We work in a number of areas. As I mentioned, I come from the urban practice. We also have health, agriculture, transport, but we've tried to find interconnection points as well to avoid working in silos, as already mentioned. But some of the areas we work in include housing, and we work on the whole value chain of housing supply, from thinking about building regulations, rental laws, thinking about mortgage finance or developer finance. How do we work on both the demand and the supply side of housing? We work around greener and vibrant public spaces, and I saw a lot in the sessions here on the topic of public space. And I just wanted to highlight that as a financier, it's often very difficult for us to convince our country clients or our board why we should invest in public spaces. And I think that's why it's really important to have the kind of research that you do that shows the impact that green and vibrant public spaces can have on health, but also on economy and vibrancy of a city. We work on areas of food and food safety. So we cooperate, for example, with the Food and Agricultural Organization, doing market citywide assessments of markets. And then we've been able to go in and finance those market upgrading. Bread and butter business is water and sanitation and waste management. And I think given the length of experience on this topic, it gives a lot of good examples how we cooperate. I noticed the RISE work that the Wellcome Trust did with the Asian Development Bank in the Pacific and in Indonesia as examples of how we can find ways to work together. And in any intervention that we have, we also look at how do we enhance the institutional arrangements. So for example, we worked in Greater Cairo on air pollution management, thinking about the impacts on air quality that were mentioned from different sources, not just transport, but other fossil fuel sources. We look at how to ensure that what we do is inclusive. And we've had, for example, a global program on slum upgrading, we've recently also done an evaluation of slum upgrading projects that we did between the 70s and 90s to see what's happening in those cities today, what worked and what didn't work, and how can we do that better. And I think the big question that was mentioned also on the financing. So we have the knowledge and awareness, but also the financing. And this is where I think we have strength and where we can benefit from working with others to see how do we define our financial incentives for urban health. So just to finish going forward, I wanted to highlight 3 gaps that we saw, and this is coming out of our report as well. The knowledge gap and the awareness gap, I think were touched upon just now, but also just to add the financing gap. And I see that these are areas where we have very clear collaboration, for example, on knowledge with WHO's strategic guide for urban health that they're working on right now. How do we think about financing gaps, working with with the private sector as well? We haven't heard much on that in the discussion so far, but how do we incentivize other actors and public-private partnerships in cities? And then finally, the awareness gap. And this conference is a good opportunity to raise awareness amongst ourselves. And we're also very willing at the World Bank to see how we can participate in your knowledge exchange activities and work together more to advance on this awareness gap. So I will stop there, Carlos, and thank you
Very
for
good.
inviting
Leave
me.
that slide.
Okay.
Thank you. Joanna, this is enormously helpful, the clarity that you have on those 3 steps. And it's not the awareness, because we tend to say, well, you get the knowledge, then you build awareness, and somehow, things will happen. So I think the fact that you're going into the capacity building later and, going into technical deep dives on cities, climate change and health, I think that depth is really, I find it very refreshing to see that, because one thing, and if you work in risk communication and health, as I've done in the past, people assume that once you develop the knowledge, you go out there, you tell them what to do, and then your job is done. And in fact, your job has just started, right? Because people have to engage, to understand, and to work with it. And the fact that there's different actors, especially on the finance. And normally health finance is very, although we know the determinants of health finance happens for healthcare largely. Yeah. And it doesn't happen to the prevention of disease in that way. It happens to health promotion, but it doesn't go as far as housing because of, not even water and sanitation. So in terms of making, and of course, the bank has this experience in working with these different actors. Who do you work with in cities, in low and middle income countries? And what brings, what's your wisdom or what is your experience in terms of bringing those actors together? Is that something that you think that is particularly inspiring? I know it's a difficult question because we all struggle with this. Yeah. But is that something that comes to your mind? I think the strategy is really interesting and relevant in terms of the pointing to these 3 areas.
Sure. So our main counterpart is always the national government, but typically they're on lending for city level actions. And there we're working with often the sort of the more infrastructure build side of a city government. So the water utility or the municipal services department. But I can see that, and the planning department. So those are the ones that we typically work with. But I think it depends very much on the type of project and the engagement that we have in the city, and also the openness of the mayor and the city authorities to really include broader stakeholders. So it can be quite dependent, but usually, of course, where there's more engagement and more action led at the leadership of the city, that's where we see, more positive results in our interventions.
Right. Very interesting. I think we'll probably come back in the broader discussion around the link with the private sector as well, and what role they can play, and how is it that you can orchestrate that in those three areas. But maybe you can leave that to the broader discussion. Well, thank you. Now, next is Neira Renshaw. Neira is now the lead of health at the Clean Air Fund. The Clean Air Fund is a group of philanthropists who got together to try to clean the air, right? I mean, that's the main purpose. I think it's the main institution in terms of philanthropic work that focuses on this. They're doing analysis to see where the money is going globally, what is the action. There's a lot of, I think the Clean Air Fund has moved a lot the understanding of where pollution is, which is extremely helpful. Neira joined the fund not that long ago and developed a health strategy. So we're curious about the health strategy. How does that link with climate and how does that link with cities? And specifically, I think from what you learned from what the fund has been doing, what has been the experience? Where do you see the boundaries or the next step in terms of working with cities in countries, the small cities, all cities? Thank you, Neira, for being with us.
Thank you, Carlos, and thanks for the invitation. Can I have my slides, please?
Sure.
I don't know who's in charge. Thank you. Yes, as Carlos said, I'm from.
Do you have the?
I think you just press it.
Ah, there we go. Thank you very much. I'm not going to ask if you know the Clean Air Fund. I don't dare, because we're a new kid on the block. So we were founded in 2019, and we were kicked off at the UN Climate Summit alongside the UN General Assembly almost exactly 3 years ago today. Our mission, as Carlos said, is to clear the air globally and make sure clean air, it's a human right and it's something that everybody can access. We're very much coming at this from a clean air as a win-win for climate change as well. So we're looking to identify solutions that not only take air pollutant emissions out of the air, but also greenhouse gases, as Maria was saying. And building the movement is very much at the heart of our organizational strategy. I, as Carlos said, joined the Clean Air Fund about half a year ago. I came from the NCD movement, non-communicable disease and public health. And one of the reasons I wanted to join Clean Air Fund is it absolutely baffles me that this is a risk factor that is everywhere in the world that causes 1 in 5 cases of heart disease, 1 in 5 cases of diabetes. It contributes to 1/3 of deaths from lower respiratory disease, which is still one of the main killers of children, 1 in 5 neonatal deaths, 1/4 of strokes, the list goes on, and yet it's so neglected, underfunded, and has such a lack of political attention to it worldwide and from the health community itself. I mean, if we think that, the health impact in terms of the number of deaths globally is equivalent to tobacco, then it really brings it home how neglected this is as an issue. Why isn't clean air as big on our political agendas and our global health and our development agendas as clean water, as another point of contrast? We also know that air pollution is a huge barrier to sustainable development around the world. We know that the deaths are concentrated, very, very strongly concentrated, sadly, in low and middle income countries, which is why our work as the Clean Air Fund is global. Also worth pointing out that the life expectancy losses to clean air are very unevenly distributed around the world. They're very heavily concentrated in Southeast Asia and increasingly in Central and West Africa as well. And the equity point that was already brought up, we're very well aware that within cities, we don't all breathe the same quality of air. We're not breathing the same air, even in the same places. It varies from neighborhood to neighborhood. Maria already mentioned Rosamund Addo-Kissy-Deborah, the mother of Ella, who died in London. And she's been really a campaigner for clean air and equity in London and globally now, which is so important. And we know these trends are getting worse, obviously, with rapid urbanization, especially in mega cities in low and middle income countries. That number of 1.7 deaths a year in cities around the world is going to go in one direction unless we take decisive action and change this political neglect and funding neglect. You probably can't see the names of the cities on this slide, but we supported this report, which came out very recently, Air Quality and Health in Cities, produced by the Health Effects Institute and IHME. And the message here is that no region can afford to be complacent. For the first time, this report has taken into account NO2 exposures, and there's a ranking here of which cities come out worse when you look at NO2. And there's a good number of high income cities on that top 20 list as well, including Paris, including Seoul, including Santiago. So no part of the world can afford to be complacent. If you start looking at smaller cities, there's a number of places in Spain on that list as well. And as I was saying, if we don't take decisive action when it comes to outdoor air pollution, that figure of around 4.5 million deaths a year worldwide is projected to grow to 7 million by 2050, 9 million by 2060. So this is absolutely a tide that we have to turn. Right in the center of our theory of change as Clean Air Fund is building a clean air movement. And that's all about getting to action from policymakers, from decision makers in business as well, to make sure that they're investing in the policies, the programs, putting budget towards it to clean our air, protect health outcomes and improve quality of life. So to get there, currently we're working in 4 geographies. We're working in the UK, in the EU, with Poland and Bulgaria being specific focus areas, 2 states in India, Delhi and Uttar Pradesh, and we've just kicked off a program in Ghana. And we work across 3 main themes, of which I'm leading the health area and building and expanding a health portfolio. As part of that, we've looked into what does the clean air movement look like globally at the moment. And with the exception of public awareness, which could always be better, we're scoring very low across a number of factors here, including the number of funders, the number of policies in place worldwide, interconnectivity between actors in this space. I think it was already raised a couple of times. We often work in silos, and we're very keen, I'm certainly very keen in our health portfolio, that we encourage actors within the health community to start reaching across, breaking outside of our global health bubbles and talking to energy, transport, industry, waste, and so on. So a lot of dials for us to move. We know that we have our work cut out. So what does the clean air movement look like? What can it look like? This is the way we see it. It includes global policy and advocacy. It includes local campaigning. There's some examples here of work that we've supported in London, for example, global advocacy, for example, going to the climate conference in Glasgow last year, campaigning in India, media work internationally, setting up a network of low-cost sensors for air quality monitoring in Ghana, to build the field as well, fill gaps in the evidence, which does still include some gaps in the health evidence as well, especially in low and middle income countries, and also making the case towards businesses that we've just touched on. So our impact so far, bearing in mind we've only been around for those 3 years, we have galvanized, I think, significant policy change in the places where we're working. We've supported development and rollout of clean air zones and low and ultra low emissions zones across several cities in the UK. We've supported the development of a program called Breathe London with the Office of the Mayor in London, which involves low-cost sensors, a very dense network of low-cost sensors across the city to support local decision-making. And the plan is to expand that kind of a model across hopefully up to 100 cities worldwide as part of a global program that replicates that. In Poland, we have now 12 mayors signed up to developing low emission zones. We've worked alongside the government. They've committed to funding a transition to e-vehicles in public transport. And also the Mazovia region is now going to support households to move away from coal for domestic heating. In Bulgaria, we're supporting development of a low emission zone in Sofia. And in India, there's a group now, there's a network of MPs, there's a parliamentary group in favour of clean air who are working together. And as I said, we've just kicked off the work in Ghana. We have a new network there, again, of a dozen city chief executives who are committed to rolling out air quality monitoring in their cities and to improving decision-making for clean air there too. And on business, last year at the COP in Glasgow, we launched a global business network with the World Economic Forum for clean air, and there's an Indian business leaders network for clean air as well. So I hope you'd agree, not bad for our first 3 years. One last thing I would be remiss not to mention, we work closely also with C40 Cities Network, which now has, I think, 48 mayors and counting. We've just added a good number of cities in Africa to those who are committed to working for clean air, to moving towards the WHO air quality guidelines in the coming years. But here the point I want to make is it's absolutely fundamental that experts on urban health in cities work to hold their mayors accountable for these commitments, that you actually help us to monitor, okay, is this working? What are health outcomes looking like in these cities? And to collect examples of best practices and be able to show that this works, so these can be springboarded into other parts of the world and replicated elsewhere. But I hope you'll agree this is really exciting as a cities network. Last thing I want to say is just thank you very much for listening, and invite you as the urban health community to come and talk to us. What I'd love to hear about is examples of best practice, what's working in terms of health outcomes across all kinds of sectors. So whether that's transport, industry, waste, domestic, any kind of sources, we would absolutely love to hear about it. We work across them all, food systems included. And on a positive final note, we've just done some research with voters in the UK. What a time to do it, but it looks like we might be heading into an election sooner. We were asking them what really motivates them, what they really care about ahead of the next election. And I think Carlos put it really well before when he was saying there's people who are worried about end of the month and there are people who are worried about end of the world. Obviously, it's, you know, the UK is extremely politically divided right now, but one thing that the research identified is that people really care about the end of their street and their backyard. People care about what happens in their community. This is a level that everybody feels more inclined to engage. So just a call for you as the urban health community. I think the solutions really do lie with you. I think there's huge possibility there to build bridges as well as communities that we really love to live in. So with that, back to you, Carlos. Thank you.
Very good. Thank you. Nina, one thing that you know, in this conference, there's a lot of storytelling. And I think the story is about the work that you've done at the grassroots level in terms of mapping stakeholders and understanding how to support the building of a movement is a very interesting story that I don't think is known by many people. So I'll just plug that in as one area that I think we could draw more upon, especially because that's more relevant to every city. You know, in a way, I mean, the big cities or the ones in C40, they are more privileged in a number of ways. But you could, the kind of work that you've been doing, or the Clean Air Fund has been doing in some of the, you know, in terms of field building, in terms of supporting different actors to in a specific context, political, cultural, you know, in terms of the drivers of air pollution, it's all very tailored to that very specific circumstance. So I just plugged in as something that I find very inspiring and that perhaps not many people know, but just leave that.
Absolutely. And I think in that sense, Clean Air Fund is also very unusual as a funder, as a re-grantor, that we're happy to support local community organizations. In fact, 2/3 of our 90 odd grants so far have been to community-led organizations, really working with the grassroots. I mean, as you're saying, when we're talking about policies to improve clean air, it's definitely not one size fits all and cut and paste. I think we understand that it's absolutely essential to kind of embed that within the local communities, to work with the grassroots organizations, to be able to understand what's going to work, to tailor that to the local context, as you said, socioeconomics, environmental, technological, everything included. You're going to get that if you work with local community organizations that you otherwise won't have that intel, but also essential to be sure that this is feasible and is going to get buy-in from the local community. Kind of making decisions far above people's heads isn't going to work nearly as well as something that's been kind of co-created with local groups. So we very much work with a huge diversity of grantees across all of our geographies. So, for example, female construction workers in India, who are very much, you know, among the most affected. We're looking at working with market traders in Ghana, being aware as well that often children of market traders are very exposed to air pollution in those settings. with, you know, communities around London, for example, in work with the Institute for Urban Health, of course. And yeah, so we're looking at kind of bringing a greater diversity of voices. And I think as a funder, it's a privilege to be able to do that, Sydney. Thanks.
Thank you. Now, I think it's a great introduction. I think we raised some very pointed issues. So I'll open now to the audience. And we have some mics who can travel. And we see Audrey Denazel here.
Thank you. Thank you very much. Really wonderful to hear all of you. It's been fascinating. I had a couple questions if I have time. One is about funding. So you've all made the case that we need integrated action and we need to understand the co-benefits and play on, use those co-benefits to engage people. My first question is about the Wellcome Trust, because I wonder if it's a perception or reality. I was told that, in fact, the Wellcome Trust much prefers to fund much more narrowly focused type of research, not really engage in these more integrated multiple benefits. Is that really the case?
So historically, Wellcome is best known as a biomedical funder. I mean, it funded the Sanger Centre at Cambridge, which it effectively owns, which has done a quarter of the world's COVID testing. It has, you know, massive genomics activity, etc. With our Planet Our Health, which was in the previous world at Wellcome, was the first time it really tried to build this type of complex systems approach to funding. And it's very challenging for a funder to do that, really, in part because of the amount of knowledge that you need internally to be able to work across really complicated spaces. So whereas the trust basically said, no, we don't want to have planetary health as the overarching framing for our program. We want to bring it into climate and health, in particular because of the urgency issues and the time that we need to make changes in. But we've already had this learning on the transdisciplinary approach, where you have to have this broad engagement. And you mentioned the RISE project. They're not represented here at this conference, but they're based out of Monash University, working in Indonesia and Fiji. And it's very much stakeholder engagement, community engagement to understand new water infrastructure in informal settlements, and then what is the actual effect on health. So they're testing that using an RCT design, which is A, expensive for a funder, and B, very ambitious. And we kind of still don't know whether that will work. But also we have to look at many different types of evidence that will help us make decisions, because if we just go down the RCT line, there'll be very little actual results to go on for the type of work that we want to advance. So I would say we're in a learning space. We do appreciate the need for transdisciplinary science, but we are also in an organization that has a long history of very funneled funding. And so internally, there's been a bit of back and forth about, you know, exactly what is the right place for us to be. And I think we are kind of finding the sweet spot. And I hope that the community will understand that is what our contribution is. I think another piece to it, though, is Wellcome doesn't want to take this on alone as a funder. We want to work with other funders. And sometimes we can create coalitions of funders where they may say, well, we'll want to do this part of the funding because that's in line with our mission. Will you take on the health side? And we'll be very interested in that. So there are different ways that we can fund. And like I said, we are in a bit of a learning curve. But our first priority now is to start moving resources out into the community to even test the ideas that are being developed and learn as we go and try and be flexible and respond to not just this community, but many other research communities that look at the intersection of health and our broader environment.
Thank you so much. Is there a chance I can squeeze very quickly another one? Is that okay? For the Clean Air Fund, this is a bit of a similar question. I've done a bit of research to understand how much air quality policies are more narrowly focused, narrowly minded just on reaching air pollution targets, or how much they have a co-benefits or have benefits beyond just air pollution. And in the study of 9 UK cities and 9 German cities, we saw that especially in the UK, the overwhelming majority of the policies were very narrowly focused, a bit better in Germany, London particularly bad. The few examples that you provide were, I think you mentioned low emission zones, or how much do you think, from your perspective, you think your funding in terms of solutions that are only narrowly targeted just at air pollution, how much is more of a transformational or urban type of solution to air quality that has many other benefits? Thanks.
Thank you. That's a tough one. I mean, we certainly say that we're looking at transformational in terms of both air pollution and climate. So we're looking for the win-wins across both. So, for example, we're not funding projects that would see kind of rollout of air pollutant filters in schools and things like that. There's hopefully other organizations that would do that. Yeah, we're looking for the solutions that would, you know, have the broadest possible both health and climate benefit. And I guess, I mean, as I said, we're still in quite early days, so we'll be looking to assess this as we go. We're putting our impact assessment framework into place now to be sure that our policies or the measures that we're supporting are doing that, but it's definitely a learning process. So if you have feedback, Audrey, I'd be very interested certainly to chat afterwards. Thanks.
Carlos, can I?
Sure. Yeah.
Just elaborating on that, because I think it's very smart. Imagine that the governments decided to endorse, even with some legal requirements, the air quality standards of WHO, the new ones, the ones presented last year in October or September. Imagine that in 2 days now, the European Union will tell us what will be those standards. Imagine that those standards are applied. Of course, that the immediate benefit will be on reducing the air pollution. But in fact, if you want to reduce the air pollution, you need to put in place almost all the good practices on urban health, because you need to look at the transport, you need to look at the waste management, you need to look at the construction, you need to look at the sources of energy. So it will be a multiplication of health benefits that we all, so maybe we need to look at what are those interventions that we know from a research point of view, or we need to decide that we have some gaps on that research and say, okay, those are the interventions that will, no matter what, generate more health benefits at the urban level. And this is what we are trying to do with the climate change agenda. If you look at the Paris Treaty, the point is, if you implement the Paris Treaty, here we are, all the urban health agenda will be implemented. So we need to focus on that as well and create all the advocacy, movement, influence, and demonstrating that the tools are there, we can measure it, we can even communicate it a posteriori, saying, because you did that, look at the health benefits that you are generating. So no matter how many crossroads we have, we need to focus on those interventions that will be enormously positive in many ways at the urban level.
Very good. But the funding is important, right?
Absolutely.
So I think the points also of connecting different sources and who funds what, when it comes to, you know, there's different agendas, right? Different people, housing would think of certain things. I mean, so I think that's an important point. And the other important point, I think, is at the local level, what can be done to make those connections? So we'll come back to that. I think we have another point here.
Yes, thank you so much for your illuminating presentations. My name is Miguel Ángel Vázquez. I come from Riverside County, California in the US. And I wanted to learn or hear your perspective on a couple of things. One, early on, it was mentioned something along the lines of misinformation. I'd like to get your sense of whether you're concerned on the state of the world in which people want to do their own research and what the role of science is, and whether the people we are trying to help, you know, I work for a public health department. What is your level of concern? Is science maybe at risk? And the second one, where I come from, there has been in recent years the development of millions of square feet of warehousing that are tied into the global markets, but also the emergence of new technologies. And, Amazon is, for instance, one of the biggest players in the area where I'm at. And there's significant health concerns as a result of that system that, in a sense, we're trying to dismantle, but it's been built. So what are your levels of concern regarding those two issues? Thank you.
So who wants to pick that up? Joanna?
So I'd like to pick up the misinformation side of things, because I think that we've learned so much about that with COVID, and the Wellcome Trust was very heavily involved in funding urgent COVID research, particularly for the accelerator, which was the diagnostics and treatments rather than the vaccines, but then also there's been the big CEPI funding, etc. And it's been a very shocking experience that at a time of such global crisis, where everybody was being so personally impacted and the threat to our lives, etc., and our livelihoods so severe, at the same time, this massive disinformation response that occurred alongside it. So that's been a really significant interest for the trust. Like, how do we build trust in science? And it's not just understanding of science, but that science relates to how we should think about the world and how we should engage with the world. So I think that is a huge concern. And it's going to be as important in climate and presumably as in many other things going forward. So my take in many ways is that, and this is a personal view, is that we have to be very careful about aligning sort of core truths, if you like, with political views, so that people don't want to engage with the reality in front of them, because they see that if they engage with that, they have to take on board all sorts of other political interests that they don't favor. So we have to be really conscious of the fact that science underpins everything, and we have to build that knowledge for everybody. And that's
Excellent. I mean, yes, please.
Yeah. Hi, this is Aprajita. I'm an independent consultant, and I'm representing an India-based not-for-profit, Mahila Housing Seva Trust, which is actually one of the organizations that pioneered the focus of climate change, climate resilient infrastructure from the lens of poor and vulnerable women. So thank you so much for the session. And I think, given the illustrious panel, I think there's more than 100 years of experience if we add up all your years of work. And so I have a tough one possibly for you all. So, as Maria mentioned, if we look at the Paris Agreement, and if we just fulfill that, most of our problems will be solved. Then as a reflection, especially after the pandemic, what do you think needs to change in 2022 in the way we've looked at those, at countries, at not-for-profit, as funders, that we absolutely need to do differently to expedite the progress? Maybe a quick one from all of you, if Carlos permits. Thank you.
Thank you. Good point. So do you want to respond, Maria?
I think the World Bank.
The bank would respond.
Actually, what I wanted to mention is we know what to do. We know the policies. We know what has to be done. But I think one thing we maybe have been remiss to mention here is that all of these things also have negative impacts on especially the poor. So affordable energy efficiency, housing, changes in transport, all these things have negative potential costs on the poorest. And that is the other side of the green transition. It's a very positive transition, but there will be impacts, and those have to be financed as well. So that to me is the just transition element that I think your organization represents as well. Thank you.
Yes, and perhaps in terms of the lies and the sort of fake news, etc. I think understanding what's truth and what's scientific is important, but also mapping out power relations and who's going to be perhaps unhappy with certain changes in the direction of perhaps of the Paris Agreement. I mean, if it was the Paris Agreement were implemented, but it wasn't, not yet. So I think it's a good direction, it's a good goal, but the question is how we get there. And I think this mixture of understanding the science, but also understanding the power relations and what are the actors, what they gain and what they lose, and to understand better the mix that can create a movement. Because that political understanding, perhaps we're not, how many of us are social scientists here, but I think that's a very important element to bring in to the natural science that we know. Please.
That just me. I don't know who here follows the American news, but Alex Jones, who's a major source of disinformation in the US and has his own show, etc., and has just been taken to court and fined nearly $1 billion for the harm that he's caused just from, not just, but I mean, from his consistent misinformation, particularly about gun violence in the US. And I think the courts can be very helpful in that sense, in responding to misinformation and where it causes harm, because that's also a very scientific approach, if you like, to the response. You can see the damage that it has done. You can take people to court on that damage.
Carlos, if I may.
Yes.
Your question about the community generating and funding at the community level. If we want the Paris Treaty to be implemented or something similar or even less ambitious, we need to create the demand. I mean, people need to feel the urgency and the ambition to do it. As Nina was saying, I mean, we are in front of an incredible number of deaths caused by air pollution. And even if we have it in front of our face, we are still not reacting as a society. So it's probably because the demand is not yet coming at the pressure or at the way we like it. We are talking about air pollution in New Delhi, but the poor people living in New Delhi, they are suffering, they are not causing it. Or if they are causing it, it's because they don't have a choice. So I think this we need to create the demand, not only from a very rich and educated left-wing greeners activists. We need to create the demand as well from those who have a very old car and therefore is a very polluting one, the ones that cannot be vegetarians because it's very expensive, the ones that they cannot have an electric car because an electric car is very expensive as well, and they don't have a public transport. So we cannot create an elite of convinced of the climate change emergency without moving all and addressing this issue of fairness and equity. So we need more support and financing at that level to create that demand and to understand the poor people, what is for me here. Because otherwise they will see it as a kind of Greenpeace type of elitist environmentalist, and this cannot be. I mean, it has to be as well for people with less financial resources.
And this has been the focus of major debate. I mean, you have the Gilets jaunes in France, exactly. You have every country has had when trying to confront the issues of, the dirty source of energy. How does that affect different groups is central to that. I don't see any other hands unless there is one. Yes, Tiago.
Tiago de Sá, WHO Age Friendly Environments. Thank you, speakers. Carlos, excellent presentations. We heard many of you, if not all of you, saying about the importance of bringing communities, practitioners, researchers, and policymakers together, but also the need for us to address this in a systemic way, regardless whether your entry point is climate change or clean air or healthy aging. But it seems to me that we lack concrete examples, platforms, mechanisms on how to do that. And we also seem to lack the evidence. It's growing, but the evidence on how to do this doesn't seem to be there as much as we would like to. So my question to you is whether you could share with us some concrete examples in your experience where this worked or didn't work, or some ideas on how we could create this knowledge to action system for change for citizen communities.
So can I just say, instead of giving the concrete examples, perhaps react to that idea. How is it that we bring those concrete examples forward in us as we structure the next stage of our thinking. We have we'll have final thoughts from each one of you. I mean, this is one of the questions. Does anybody want to respond to this point that Tiago was raising about the concrete examples about the how and how to engage these different groups?
Could I, maybe it's not an example on a city scale, but it's an example of a global partnership that I think it could be an interesting model for us. It was the public-private partnership on hand washing with soap. It started in the early 2000s, but it brought together different actors, the UN, the World Bank, the Procter & Gamble, Unilever. So it brought together people with the evidence base, people who work with cities, but also with concrete projects on the ground, looking at understanding the perceptions, the evidence base, bringing the private sector knowledge about how to do behavior change. I think these are the kind of coalition or partnerships around urban health that we should be thinking about as examples, as you said.
The model.
I think, Tiago, Carlos, another example that's maybe we are underestimating here, but somebody, I think you mentioned it, is the wash and waste community. I mean, the water regulators or utilities, they are very strong networks as well at the city level that they have been operating for probably one of the longest ones. So you see enormous improvements and in that. Other examples are the associations on public transport. As you know, they have been, depending as well on the leadership of the city, they have brought incredible results. I think something that we didn't consider either is the human rights approach, and it's now gaining a lot of space because of the recognition of the right to healthy, sustainable environments for all. That is gaining, again, a lot of traction. And we have been working, as you know, on tools under the urban health initiatives, where you look at what are the practices, what are the models, what are the experiences. And I think later on you can hear a little bit more about that. But I think cities like Valencia or Bilbao in Spain, I don't know how many of you know Bilbao, but it was one of the ugliest cities in Spain. I hope there is no one from Bilbao here. Otherwise they are gonna kill me. Yeah, there is one. Oh my God. Oh my God.
But it was one of the.
It was one of the ugliest, and now is one of the better ones, the most beautiful ones. And it's because of the vision and the way they work at transforming the city from a horrible one, polluted one, without industrial, vision or anything. Now is a fantastic city with art, with walking spaces. And of course, the health benefits are enormous there. So I use it Bilbao for the good reason. I
think over lunch, we were discussing how road safety offers some of that. And it led to creation of, mechanisms which are sometimes the police would take over the lead, sometimes the health sector, sometimes it's somebody else. So I think there's a number of that, but there's a good point that those have to be collected. So I think we're about to round up. I'll give you a few seconds each to have a final reflection or something that was brought to, in the discussion you think you would like to communicate. You don't start, Nina.
Thank you. Yes, I wanted to answer Tiago's question. I think the tobacco control movement has that as well. You can see, as legislation has been brought into force, particularly in the US, they track this really well, what the health outcomes were at each stage of reduced consumption. And I think this is something that we're lacking in air quality so far, the ex post impact assessment. Okay, what happens here? When I was working on a health strategy, it struck me how few examples there are of this that you can concretely say, okay, that happened, and then this was the health outcome, with a few valuable exceptions, like the natural experiment around the Beijing Olympics, for example, is a great one. Or over time, you can see the cumulative benefits of the Clean Air Act in the US, which are absolutely incredible, the number of lives that has saved. Or discrete measures, like there was a coal ban some years ago, or coal restrictions in Dublin and Ireland. So I think we need to collect a lot more of those, which is why I'm kind of shouting out to this community, please let us know if you have more, because I think we need to be kind of bridging the gaps and the kind of fractures in our society by telling the stories of what works and then building on that with a vision that doesn't just benefit one community, does actually look at equity, climate, air pollution, livability, all at the same time. But I think, you know, the wins are to be had at the interface between specializations, between areas of expertise. One thing that was said before, sorry to bring this back to a British perspective again, but one thing that was said by a very prominent politician in the UK before the Brexit referendum was people have had enough of experts. And I think given what's happened just in the last few weeks in the UK, that everything's coming to a head, I think the moment for experts may be about to come back with a vengeance. So keep it up.
Dear, yeah, good comment. I just want to build on that. And then I mentioned earlier on that we're cooking our next round of funding. And it is very much around the idea that, yes, we have a largely the climate change is understood, that climate change is happening and people even see it, that it's getting warmer, etc. But that concrete evidence that relates to the area that you live in, the specific industry that you're engaged in, the specific community, very often that's lacking. And the call that we're in development of is around, can we create that evidence, not over 10 years, not over 5 years, but really go in and find out the most important information that can make visible the impacts of climate change and the actions that need to happen in particular communities, and align that with the practitioners and the advocates and the communicators. So that's the general place that we want to sit this call. And I hope that it could respond to just the issues that you raised there. Policymakers want to know what's visible in their own area, in their own jurisdiction, effectively. And somebody has to fund that type of work. And hopefully we will put together a call that will respond to that. But like I say, I'm here to hear from you whether that even makes sense. But she said it did.
Yeah. Yeah, I think that the AIDS community has been an example as well on how to work with the communities and how to create an awareness and promote and go as far as at getting the treatment. So maybe we should learn as well. Tobacco, definitely. When we did the air pollution conference, remember, we said that air pollution was the new tobacco. The tobacco groups were a little bit upset with us. I don't know why yet, but it is the new tobacco. So we really need to act like, creating from the beginning the awareness, explaining people what is doing to their health, and then creating all the political mechanisms. But I think climate change can be a very strong opportunity, and again, linked to air pollution. And if we accelerate on that, if we use all the knowledge we have, the tools we have, and we use the expertise, but oriented and keeping in mind that there is an emergency here and then a crisis and they need to respond, making sure that we will not reopen the coal industry again or things like that. So the more we document how cities have been transformed, I mean, in the north of Spain, here, since we are in Spain, we were all relying on an economy based on coal. And today it will be absolutely out of question, but we have Poland still relying on coal as a very strong one. So the more we documented how removing all of those environmental stressors have been an incredible benefit for the health of the people, the more our cities will be and healthy, and of course we will promote the well-being. So Joanna.
Thank you. Do I need to?
No, I'll hold it.
So I just wanted to, in my closing, highlight, last year we did a report on the state of city climate finance, looking at where financing comes for cities to invest in mitigation and adaptation. And the vast majority comes from private individuals, households. The next is from private sector, and then a small amount from national governments and IFIs like the World Bank. So I think the way we define whatever approach it is really has to be centered around thinking it's actually individuals that will finance this transition and the private sector in majority. And so when we think of any kind of coalition at the city scale, how do we mobilize that? And I hope that we get some ideas from today's discussion and think about some of these modalities, approaches, either at the global level or at the city scale, with the help of your society, Carlos.
I think that
Thank
sounds
you.
brilliant as a way to close. And I think you're all part of this connection and this discussion, this debate, which includes some of those different dimensions. And I think learning the lessons for what didn't work is as or more useful than the lessons for what did work. So I think that having that balance and having that understanding, not only the science, but in the politics and the power relations and in the aspirations that different people have and the fake news. And so it's a complex and very fascinating, I think, set of issues. And I think we can close with this understanding that you are part of this thinking that we're going to do together in terms of what are the mechanisms, what are the examples, the bad ones, the good ones, and how is that we can construct something around cities for small, middle, all cities around these issues of climate change and health. I thank you enormously for the opportunity. It was a pleasure to have you here. Thank you.
Thank you.
And thank you, the audience. We have coffee now.